Hi, I'm Bill Mosteller, Chief Executive Officer, Diagnostic Laboratory of Oklahoma. DLO is the leading service provider of medical information in the state of Oklahoma. We serve hospitals, physicians, and more importantly, their patients all over the state. Last year, we did 9 million laboratory tests. 95% of those tests were done in our laboratories in Oklahoma. DLO employs 215 phlebotomists. They're caring and they're skilled. We're the largest employer of medical technologists in the state. We have over 200 registered medical technologists. Our route service representatives, our couriers, log 10,000 miles a day, and that's not a made-up number. And they work through weather, snow, sleet, ice, tornadoes to ensure quality lab results. DLO has been awarded the designation of Best Places to Work in Oklahoma for 11 straight years. For the last 3 years, we've been nationally recognized as one of the best places to work in all of healthcare. DLO has 700 dedicated professionals that are part of the DLO family. We're passionate about being involved in healthcare. We understand that our mission is to take care of our fellow Oklahomans. We take that mission very seriously. I'd like to introduce you now to a few of our valued, caring professionals. They will share their personal experience and their professional experience about the jobs they do at DLO. They make a difference.
The oil field market took a turn for the worse, and I was without a job. So I accepted a job offer that I didn't really want to accept, but I needed to accept for my family. I was sent by said employer to a Diagnostic Lab of Oklahoma to have a drug screening done. So when I arrived at the facility for my drug test, I asked the person doing my drug screen what it took to become a phlebotomist at DLO. And much to my surprise, you didn't have to have years of schooling. You can actually learn the skill of phlebotomy at DLO. To make a long story short, I was offered a position, and it's one of the best things I could have possibly had happen to me. So a typical day in the life of a DLO phlebotomist includes several job functions, such as data entry into our computer system, specimen collection, specimen processing, accepting payments, accepting drop-off specimens. We deal with patients ranging in age from pediatrics to geriatrics. We do biometric screenings, drug screenings, life insurance exams. We don't just do one job. DLO phlebotomists wear many hats, and I think it's important for phlebotomists to have and possess characteristics such as integrity and compassion. It's important to be passionate about improvement, so if you make a mistake, it's important to be positive about it and try to find the positive in it so that you can learn from it and pass that knowledge along to your teammates to provide your patients a better experience. It's vital in a phlebotomy role to be able to put yourself in the patient's shoes and try to view things from their perspective so that you can take the best care of them possible. I have found a career that I will stick with for life, I hope. It's not just a job, and I feel that I play a very important role in patient lives. Someone once told me that your life is only as good as the last person that you helped. And by working at DLO, I have the opportunity to continually do so.
Dispatch will send me a page to my phone to what needs to be picked up and tell me where I need to take it to, what location I need to take it to. I use my scanner to scan the barcode that's on the requisition, carry it in whatever temperature it needs to be carried in, and then proceed to go to whatever lab that I need to take it to for testing. This could be a test for a little baby or test for a pregnant woman, those results are important. So just realizing that, hey, I'm carrying someone's life in my hands. So just be extra careful in transporting the specimens. I know that DLO, we are number one when it comes to laboratory diagnostics. So I take pride in knowing that, hey, I'm helping patient quickly get the results back. Specimen integrity is very important to me because I know that if I don't transport the specimen in a specific temperature or get it to the testing lab at a specific time, that can ruin the test. There's some tests that we have that are time sensitive. So I realize that I can't lollygally around. I gotta get to that lab, drop it off safely and as quick as possible. We get a lot of training. We do monthly meetings. Training varies from driving safety to specimen transportation and even a relationship with clients, how to customer service and stuff like that. So we also can sign up for these classes called IntelliQuest, where it goes into more depth of client relations and how to better treat our clients. I really love the family atmosphere and the caringness about the actual individual that we have here.
Everybody gets sick and everybody needs to have testing done. And you want to be able to trust who has your information and what lab work is getting done on you. And I feel that our morals are very high standard, and I believe that we make an impact on the patient that just needs to get their tests done in a timely manner. So as long as you have that teamwork personality and you're willing to talk to everybody and ask a lot of questions, because there's a lot of questions that need to be asked. There are people that have worked there for 10 plus years and still are asking questions just because of how much things are changing. And as long as you get along with your coworkers and are able to do what needs to be done, then you have it. I did a lot of research before working for a company because you want to make sure that what you get yourself into is what you love to do, and you want to be able to work in a happy environment, in a place where you just love coming to work every day. And what made me choose DLO is not only is it #1 job workplace in Oklahoma, but also it's very family oriented and they love working with people, and everybody here is just a happy family. We greet everybody like, hey, how's your day? Even if it's just a little hey or hi or how are you doing? It's just a very happy community and I like it. That's why I chose DLO.
I'm a medical technologist working in the immunochemistry department. I perform tests in chemistry and immunology. I ensure quality control, or QC, is being performed daily before patient testing use. I also perform instrument maintenance and troubleshoot as needed. I don't think there's a typical day for us as medical technologists because we always find new cases daily, and each case is always different. The sooner we release the test results, the sooner the doctors can help with their specific therapy, and the sooner we can help the patients feeling well to see their smile on their faces back again. DLO has this scholarship opportunity for employees to continue their studies in the medical technologist program. And they also have the on-site training where you work as a tech for 2 years. And once you've done your 2 years as a tech, then you can challenge the board exam. I love my coworkers. I can always depend on them when I needed help. And we spend 40 hours a week here, so I develop attachment to them like a family.
On a daily basis in client services, we take incoming calls for test results, add-ons. We receive emails from clients and from our patient service centers. We do outbound calls as well. If we have any tests not performed or any critical results we need to let the client know about, we call them and tell them about that. I find satisfaction in my job by taking care of the patient. I started off as a phlebotomist, which helped me, but DLO will give you the training to help you know what you need to have in this role as a client service representative. I feel like client services department impact on the patient is that once we get our results, that we get it out promptly and on time to the physician so he will be able to take care of that patient. I love having an impact on people and helping someone, and DLO has gave me that opportunity to do both, to be able to have an impact on someone and still love what I do.
So as you can see, we have a strong commitment to serve our fellow citizens of Oklahoma. You also notice that our mantra is patients always come first, always. We are committed, we are passionate about making a difference in healthcare. And that passion and that commitment results in the highest quality and most efficient medical laboratory services. I thank you for allowing us to serve you.